Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
Chapter 53 Coordinary Care for Patients with Musculoskeletal Disorders on the NCLEX review. So please stay curious, stay informed, and keep learning. Like, share, and subscribe for more insights and nursing tips. This review it's from the Davis Advantage Medical Surgical Nursing, and perhaps next year in 2026, in March, end of March, will be a new NCLEX style. If something it's new beside this, like a major thing that I do in this video, then I will come back and I will update for this chapter. I will say part 2 or version 2.0 of NCLEX. So I hope you like this little image here. It's Gemini made it for me, so it's super cool, related to this skeletal. Oh, you see this here? Oh, the car tunnel. Okay, so we go. So this I always say, it's somebody that was from a Facebook group that said that had here with basic care and comfort was below. It's spread here. And then the green one was above and the yellow was near to passing. So we go one by one. This is my style. We go one by one beside definitions, and we make sure that we follow this NCLEX study guide. It's from their website, says like how much it's management of care. If you see 15 to 21, so it's here the pie. So this slide pizza, it's quite big, and also pharma, it's big. Basic care and comfort, it's not, it's this yellow, but it's 9%. Imagine if you have 100 questions and some of the questions on the selector of the apply has more than those categories here. So basically, at the end of this video, I will show you 3 selector of the apply that has 2 of these, basic care and something else, and then management care. So basically you can see like 2 subcategories in a question related to this chapter. So we go chapter by chapter, and you'll see how little bit tricky it is, because if you don't select that, like for instance basic care and comfort on that selector of the apply, then you don't get this 9%, and then you become here below. So the NCLEX is broken in these 15 specific areas, domains. It's not just knowing your content, it's about knowing how you know to apply in different situations. And in, let's give an example, a situation, it's in this chapter where there are like 7 diseases, and And those domains include the traditional, like this is the traditional 1-8, and then the clinical judgment here down below, which is a huge focus for the new exam. Recognizing our notes around those 15 domains, we can learn how it plays them into the correct context. So again, we need to review making a connection to clinical judgment, recognizing cues is what clinical manifestations are observed in this patient. And we have 7 diseases in this chapter. Analyzing cue, how do the clinical manifestation correlate to the underlying pathophysiology? Pathophysiology is very important, especially for the RN. In LVN, they give you like a little section, you know a little bit, but for the LVN, they do management of care. Pharma is not that huge. I just know because when I did it, it was very, very limited. I mean, probably I just did it so quick that I even had noticed that I have even pharma. For the LVN, they might give you like a very basic calculation, but for the RN, because of management of care, pharmacological, then you need to have more calculation in like with drops and all kind of stuff. I don't go too much in detail of that, but one of those days maybe I can go very, very, very deep. So pathophysiology is very important for the RNs, very important. And skills more about IVs and blood interaction, that is very important. Um, Recognizing hypothesis, what could happen if these patient symptoms are not effectively managed, generating solution. What treatments are included to manage this patient condition? 5, taking actions. What are the priority intervention for this patient? 6, evaluating outcome. What findings demonstrate that the treatment plan is effective? What follow-up data are needed? So basically, you either LVN or RN, when you do something for a patient, automatically you need to ask after 30 minutes, 60 minutes, depends of the treatment, and ask and observe and assess if that medication treatment provided by the nurse is effective, yes or not. If it's not, then you need to do more. But if yes, you need to document that whatever you did, it worked. For medication, if you do pain medication, for instance, does the patient has more pain or not? Did decreases at least 20%, 25%, so you need to document everything you do for the patient. You need to document, and then later on you need to say it was effective, tolerated well, it was effective or not effective, or halfway. So now let's go moving to the chapter more in depth. NCLEX domains, you see here, like clinical judgment. We have assessed for signs of infection, pain, complication. I take my light away just for you to take a short screen because I'm not going to read everything. Assess for signs of infection, pain, of complication in patients with bone disorders. Monitor neurovascular status and signs of impaired mobility. So red flags. Delaying treatment in osteomyelitis can lead to chronic infection or sepsis. Sepsis is very, very important. So to remember the 5 P's, it's always with muscular, pallor, pulse, paresthesia, paralysis. So it's very, very important. Nursing process, use ADPI to plan and evaluate care for patients with osteoporosis, scoliosis, MD, and post-op TGA. So skipping reassessment after intervention, that is a red flag. So usually you need to know that after 30 to 60 minutes, you need to reevaluate. Standard care for plans. And then let's go to basic care and comfort. Pain management, mobility support, positioning for post-op care of spinal orthotics. So here, when you do mobility support, especially for a patient that has these disorders, they have a lot of risk of falls. So if they have a walker, like how you teach a person to use the walker properly, like how far can be. Imagine. Oh, I've been seeing this. I'm just laughing. Um, Also crackers, or going down the stairs or upstairs on the stairs if they have this post-op like total joint replacement, so they are on the second floor. You need to think about that. You need to go back and read and how, because it's more detailed to think about, but this is just on input. What I do, it's just an input and give you some ideas where to focus more. So ignoring pain management before mobilizing the patient. So every time if a patient is in pain and something it's post-op or some diseases, when you provide care or repositioning or going to physical therapy, needs to make sure that it's mostly pain-free. So that's why you need to give medication before, not after. But I doubt that are nurses that do that. But I think here with basic care and comfort, it's mostly like mobility support, positioning for post-op care. So I think this is the tricky area that might be in NCLEX. And if the candidate mistake partially, then you get the easy one about pain management and reevaluate something pain scale. So I think this is very easy. So gonna give you an easy question after if you mistake, but I think gives you one try, and if you don't do the easy one, perhaps might give you another easy one, but after that it's just I think will not gonna be another try for that section of a pie. The pharmacological, so administer here the antibiotics, pain meds, monitor for side effects, right? Yeah, you need to know when you give. There are a few medication they are like obvious. You need to, they have a specific, how to say, they're specific. Give in the morning, empty stomach, or with food. Don't give with milk. Don't give with this. Like even the thyroid medication, give it on the empty stomach 1 hour before other medication, no food intake, all kind of this. There are specific medication that they have this reduction of risk potential labs, calcium, vitamin D, white blood cells here. Yeah, the fat embolism is very important. Early signs of post-op hemorrhage or fat embolism, because they don't move, they need to start moving, so you need medication, make sure the labs, everything. Continue more psychosocial adaptation, support bone healing, reduce deformities, and prevent contractures. You see post-op rehab timelines, management of care, coordinate with PTOT, home care, discharge planning, and interdisciplinary and other disciplinary team. Coordinate of care, communicate with specialists, ortho. Let's see. Missing post-op site updates in the chart. So here is very important to have it to look on, just to read in those case studies, case scenarios in the NCLEX. They have clinical data, and every question they have a new updates in like in the case scenario they have more, like each question will have more data, so be careful you read there. Yeah, teaching exercise, and yeah, ignoring signs of neglect and in immobile patients, using updating or anecdotal treatment. There are red flags that might trick you a little bit in NCLEX. We're moving forward more in depth, like high heel topics, what to watch for, what the items ask you to do, classic pitfall to avoid. Here, like physiological adaptation, chronic condition like osteoporosis, MD, sclerosis, healing from fracture or cancer. This will be more in NCLEX, and they will ask you to evaluate coping adapt care based on condition progression, forgetting to monitor function changes or adaptive needs. Basic care and comfort, pain management, it's always important. Select appropriate conform measure and analgesia. Overlooking on non-pharmacological comfort option. Make sure you give the pain treatment that was prescribed. And here with pharmacological, yes, opioid constipation is very important one to make sure it's the patient is not constipated. I think it's a rule nowadays that physician when the gives an opioid, a pain medication, a strong pain medication, automatically PRN as needed will be to prevent constipation. I think they have every patient nowadays but if it's not in MAR, so in medication list, then just ask for as needed. Here it's the classic NCLEX domains. Let's go. So this is definition. This is example from our chapter 53. Let's go to basic care and comfort. provides comfort and assistance in the performance of activities of daily living. So imagine you have this chapter in NCLEX and it's 9%. Basically, it will be 1 or 2 questions, and this chapter has 7 disorders, and mostly like an example, assisting the patient who has undergone knee replacement surgery with ambulation, pain management, and using assistive device like crutches or walkers. So a nurse, like for instance, this is mostly for home health nurse. When the home health nurse goes into a patient house and see how they walk, so make sure that the floors they are carpet or rugs, cables, um, away, less furniture, and the nurse will evaluate how the patient goes, let's say, from bathroom to the kitchen, kitchen to the couch in the living room, and if they have a proper or not, and then it's reinforcing education, and also ask for PTOT for more evaluation. And it's good that nurse will look, but also the CNA, the certified nurse assistant, they will also can tell to the nurse what they observe. But this is mostly in basic care and comfort, and it's 9%. Can you imagine? Like you get from this chapter 1 question, and this is like crutches, like assisted devices. Oh my goodness, this is like NCLEX loves these. CNAs in their exam they have, LVN in their exam they have, RNs. Why? Because it's safety. That's why. And a lot of people do a lot of surgeries, so post-op knee replacement, hip replacement, and it's very important to know and to evaluate this. Pharmacological, again, constipation, depression, opioid, what else? Yeah, with constipation, it's always good to have a PRN for this. Make sure that in med list it's a PRN as needed. Coordinating a patient care plan after a hip fracture, including scheduling physical therapy, occupational therapy, and follow-up appointments with orthopedic surgeon. This nowadays it's much easier because in hospital right on when it's done, but this is just to know the new nurses. The senior nurses already prepare everything, so oncoming nurses, that the new nurses, the brand new, they need to know that on the discharge paper, the follow-up appointments are there and evaluating for physical therapy, OT, and all kind of healthcare personnel. Okay, we go next. We're finally in questions. So question 1, domain reduction of risk potential. A patient with DMD, Duchenne muscular dystrophy, is admitted with worsening shortness of breath. Which assessment finding is the priority? Difficulty walking upstairs, B. Increased serum creatine kinase, decreased forced vital capacity, presence of calf hypertrophy. Correct answer is decreased forced vital capacity. So because the reduced forced vital capacity indicates impaired respiration function, a critical, potentially life-threatening complication in this DMD. It reflects the muscular involvement of the diaphragm and the intercostal. This is a high priority red flag requiring immediate intervention to maintain the airway and ventilation. Oh, the peep is that I want to move to the next slide and looks like it doesn't like that. Question 2, domain, NCLEX domain, physiological adaptation. A patient with newly diagnosed osteoporosis is prescribed alendronate. What instruction is most important to include in patient teaching? Take the medication at bedtime. Take it with a full glass of milk. Take it in the morning with a full glass of water and remain upright for 30 minutes. Take it with food to reduce GI upset. Correct answer is take it in the morning with a full glass of water and remain upright 30 minutes. So this question, I put it in the previous chapter and here because it's very important. The more we know, the better we'll remember, and repetition, it's a brain muscle because it's osteoporosis and it's many people struggle with osteoporosis and they have this medication prescribed. So it's very important to have it. I put this medication because it's very common medication. So I put it many times. So the alendronate can cause esophageal irritation. To reduce the risk of esophagitis, the patient must take it on the empty stomach with water and remain upright. So this is the definition. It's one of those medications that they have typical and typical signature. Question 3, NCLEX domain, health promotion and maintenance. A nurse is developing a teaching plan for a postmenopausal patient at risk for osteoporosis. Which lifestyle modification is the most appropriate to include? Avoid all weight-bearing activities to protect the bones. Increase intake of phosphor-rich foods. Engage in regular weight-bearing exercise like walking. Limit calcium intake to prevent kidney stones. Encourage in regular weight-bearing exercise like walking. I just said earlier that it's good to have small little walking because it's just for DVT and other way to manage a basic care and comfort. The weight-bearing exercise promote bone density and are essential in preventing osteoporosis in menopausal patients. Domain, NCLEX domain, basic care and comfort. The patient recovering for total hip arthroplasty reports pain with repositioning. Which nursing action is the priority? Administer prescribed analgesics before movement. Encourage early ambulation despite discomfort. Delay repositioning until physical therapy arrives. Use the heating pad over the incision site. Administer prescribed analgesic before movement. I said earlier in the video that prior any exercise or repositioning is good to give pain meds. You don't put on the side the heating pad. Pain should be managed to encourage mobility and prevent complications such as DVT and contractures. Administering analgesia before movement support mobility and comfort. Domain, NCLEX domain, reduction of risk potential. A nurse is caring for a patient post-surgery for osteosarcoma with limb salvage. What is the most priority assessment? Rating, capillary refill, and pulses in the affected extremity, temperature, surgical incision appearance. Capillary refills and pulses in the affected extremity because the vascular status is the priority after limb salvage procedures to detect possible compartment syndrome or poor perfusion. NCLEX domain, pharmacological and parental therapies. A patient with Paget's disease is prescribed a bisphosphonate, which lab values require immediate follow-up. Calcium 8.4, hemoglobin 13.1, white blood cells 6,000, potassium 4.0. Calcium 8.4. So the bisphosphonate can further lower calcium level. A calcium level of 8.4 is borderline low and requires close monitoring. For labs values, I have flashcards on different playlists on my channel. So that is from ATI, and I made it with little music. So if you like it, check it out. And then when in the flashcards they are very fast, it's just brain memory to realize fast, because in NCLEX you need to think fast, and also for the patient. Question 7, NCLEX domain, physiological adaptation. Which symptoms, so here we talk about symptoms, most likely indicates chronic osteomyelitis in an adult patient? Pain revealed yet by rest, sudden high-grade fever, constant localized bone pain, generalized body rash. So correct answer is constant localized bone pain, because chronic osteomyelitis presents as persistent localized bone pain, often accompanied by warmth and tenderness at the site. My dog now says like, "Mama, it's dinner time." NCLEX domain, safety and infection control. Which nursing intervention is essential to prevent infection? So, infection control to prevent infection. In a patient with an open fracture and external fixator, apply warm compress to the site daily not. Administer antibiotic only when febrile. Perform pain care with sterile technique per facility protocol. Limit range of motion exercise to prevent stress. So perform pain care with sterile technique per facility protocol, because pain care is essential to reduce the risk of infection at the site of external fixation. So make sure that you see, like in the safety and infection control can give you a little bit trick. So with administer here, where is my pin light? Administer antibiotics only when febrile. No, only when you a nurse provides the treatment as the doctor prescribed it, if it's 3 days, 5 days, 7 days, all together. So not only when it's febrile. It's not a PRN. Domain, NCLEX domain, management of care. A patient with scoliosis has a Cobb angle of 55 degrees. What is the nurse's priority when preparing the patient for surgical spinal instrumentation? Provide discharge teaching, administer antibiotics post-operatively, assess for understanding of the procedure and pain expectation, encourage frequent repositioning. So assess for understanding of the procedure and pain expectation, because pre-operative teaching, including what to expect post-op, especially regarding pain and mobility, is crucial for surgical readiness and safety. NCLEX domain, psychosocial integrity. A teenage patient diagnosed with muscular dystrophy expresses feelings of isolation and embarrassment about using a wheelchair. What is the best nursing response? As you see, here is a teenage patient, so it's pediatrics. So it's a little bit different, but keep in mind that you need to accept your condition. Have you considered joining a support group for teens with MD? Don't worry, things will get better. Most people don't notice wheelchairs. Have you considered joining a support group for teens with MDs? Support groups provide psychosocial support, peer connection, and shared coping strategies, which are essential for adolescent development. So basically, because it's feeling of isolation, depression, a nurse needs to do a referral and ask for referral. And this is one of the type that in NCLEX or quizzes or exams they ask you to do. NCLEX domain, reduction of risk potential. A patient with a new cast on their right leg reports increased pain with pain that is unrelieved by medication, and a tingling sensation in their toes. Which of the following is the most important initial nursing action? Evaluate the leg on a pillow above the heart level. Administer a strong dose of pain medication as prescribed. Stronger. Instruct the patient to wiggle their toes periodically to improve circulation. Assess the patient toes for capillary refill, color, and temperature. Of course, assess the patient dose and capillary refill, color and temperature. So this is the correct. So the patient is describing neurovascular compromise, the potential signs of compartment syndrome, which is a surgical emergency. The nurse's first and most important action is to assess the extremities for circulation, sensation, and movement. So remember the 5 P's: pain, pallor, pulseness, paresthesia, and paralysis. So elevating the leg in option A could worsen compartment syndrome by reducing arterial perfusion. Administer more pain medication in B. Option treats the symptoms, not the cause. Encouraging movement on C. Option C could delay proper assessment and worsen the condition if compartment syndrome is present. NCLEX domain, psychosocial integrity. A nurse is caring for a patient who is 2 days post-operative from a total hip arthroplasty. The patient refuses to get out of bed and says, "I'm afraid I will dislocate my new hip." What is the nurse's best response? "You shouldn't worry. The surgery went well, and the risk is very low. Let me teach you how to move safely so we can help prevent dislocation together. See, you'll be fine. I will be right here with you when you stand." Oh my goodness. D. If you don't get up, you could get a blood clot or pneumonia. So the correct answer is B. Let me teach you how to move safely so we can help prevent dislocation together. This response acknowledges the patient's fear and prevents patient-centered education focused on safety and empowerment. It addresses the psychosocial barrier, the fear, while promoting safe mobility, which is essential after joint replacement. Responses on A and C options are dismissive, and on the D may increase fear without providing support or solution. And question 13 about the NCLEX domain, psychosocial and parental therapies. It's selected of the apply. It's in osteoporosis medication. So here I have this example where we have 2 NCLEX domains and the selector of the apply. A nurse is providing discharge instruction to a client with osteoporosis who is prescribed alendronate sodium. Which information should the nurse include to ensure safe administration and effectiveness of the medication? Take the medication first thing in the morning. Swallow the tablet with at least 6 to 8 ounces of plain water. C. Remain upright for at least 30 minutes after taking the medication. Take the medication with a mild anti-acid to prevent heartburn. E. Avoid taking aspirin or non-steroidal anti-inflammatory drug NSAIDs while on this therapy. See, I repeat again this medication, as you see. Correct answer is, so you see, correct answer is A, B, C, and E. According to the text, the chapter, according to my chapter, aldenorate must be taken first thing in the morning with 6 and 8 ounces of water to ensure absorption. The patient must stay upright for at least 30 minutes to prevent esophageal irritation. Aspirin and NSAIDs should be avoided to decrease the risk of additional gastrointestinal upset. Antacids or other foods should not be taken within 30 minutes of administration. So be careful here how tricky this question can be. So let's dive in more detail. The pharmacological and parental therapies we know focus on proper administration, how the drug is absorbed. So option A and B, they talk about pharmacological. So take the medication first thing in the morning and then swallow with 6 and 8 ounces of water. So, and then on reduction of risk potential, focus on preventing complication or negative health outcome resulting from the therapy. So option C and E, as you see. So if a candidate mistake one of those, well, pharmacological should be okay-ish because you have more chances, because in the pie it's they have a lot of percentage there. They have a lot of percentage, but the basic care, as you saw, it's 9%. So you see, like, even its medication, avoiding aspirin or NSAIDs to reduce the risk of gastrointestinal bleeding or ulcer, as combining those with alendronate increases specific potential hazard. So even if it's medication, can be in reduction of risk potential. Just to keep in mind how NCLEX can make you in that candidate performance report. So let's go moving forward. Question 14, we still are in osteomyelitis infection, domain psychosocial adaptation and safety and infection control. So it's selector of the apply two NCLEX domains into one question. A nurse is assessing a client who has been diagnosed with acute osteomyelitis of the left tibia. Which clinical manifestation should the nurse expect to observe? Selector of the apply. Temperature greater than 101, 38.3 Celsius. Localized erythema and warm at the site of infection. C. Constant pulsating bone pain that worsens with movement. D. Cool pale skin distal to the infection site. E. Pain that is relieved by resting the extremity. So here the correct answer A, B, C. The text states that clinical manifestation of acute osteomyelitis include fever, swallowing, tenderness, erythema, and warm at the affected area. Pain is typically defined as constant localized pulsating and is not revealed by rest. Cool, pale skin is a sign of muscular compromise, not the inflammation associated with acute osteomyelitis. So here is in the nursing management area on osteomyelitis. So let's go more and to break down by domain. So safety and infection control is option A and B, where they talk about the temperature, right? Is infection control and safety. And B, localized erythema, the redness, and warm are classic signs of inflammatory response to infection at the site. The next, the psychosocial adaptation focus on pathophysiology and how the body changes in response to illness. So the option C, constant pulsating bone pain is specific psychosocial physiological response to the pressure, and ischemia, lack of blood flow occurring inside the bone tissue due to disease process. So you see how, again, this question has two NCLEX, and if you mistake, like let's say not C, then imagine that psychosocial adaptation, you get minus on that pi. So here overlap note, while fever and redness are also psychological changes, they are most heavily weighted in NCLEX under safety and infection control when the diagnosis is in an active infection like osteomyelitis. So just to kind of give you like an idea how might be in NCLEX. Here with total hip arthroplasty, post-op care domain, basic care and comfort, and clinical judgment, take action. A nurse is caring for a client who is 1 day post-operative following a total hip arthroplasty. Which intervention should the nurse take to promote recovery and comfort? Select all the apply. Maintain the affected leg in an adducted position using a wedged pillow. B. Elevate the head of the bed to 90 degrees for meals. Apply ice packs to the surgical site as prescribed. Administer prescribe analgesic 30 to 45 minutes before physical therapy. Inspect the skin on the heels and sacrum for redness every shift. Correct answer, maintain the affected leg in adducted position using a wedge pillow. Then we have apply ice, administer prescribed, inspect the skin on the heels and sacrum. So here is the rationale how the clinical judgment, so take action, focus on implementing intervention to address the prioritized hypothesis. In this case, preventing dislocation and injury. Option A, that is the taking action, maintaining adduction, keeping legs apart, is a critical action to prevent the prosthesis for dislocating the site. Basic care and comfort, you see here they have 3 questions, and imagine it's 9% of NCLEX. Imagine if you get this question and already you get minus points if you mistake in this question. Option C, option D, and option E. So apply ice. So it's a non-pharmacological comfort measure that reduces edema and local pain at the incision site. Option D, administering pain medication prior to activity is a standard comfort measure that ensures the patient can participate in rehabilitation with manageable pain level. Option E, inspecting pressure points. Healed sacrum is a basic care intervention related to the skin integrity, essential for immobile post-op patient to prevent decutatus ulcers. Incorrect option B, patient with with total hip arthroplasty should generally avoid flexing the hip greater than 90 degrees. High fallers for the first 2 to 3 months to prevent dislocation of the new joint. Case study, adolescent male with leg pain. Scenario, a 17-year-old male client presents to the clinic with complaints of dual arching pain in his left distal femur that has persisted for 3 months. He reports the pain often wakes him up at night and has gotten worse since he started football practice. On assessment, the nurse notes a palpable, tender, firm mass on the left thigh. The client has a slight limp. Vital signs, blood pressure 118/72, heart rate 88, respiration rate 18, temperature 99.1 Fahrenheit, 37.3 Celsius. Lab notes, the provider suspects a musculoskeletal disorder and orders diagnostic imaging. Question. Complete the diagram by selecting the most appropriate action to take, the potential condition, and the parameters to monitor. So this is like the bow tie. You see here the correct answer and rationals. So the potential condition is osteosarcoma. So the rationale is that the patient fits the classic demographic, adolescent male aged 10 to 30, and presents with key clinical manifestation found in our textbook: localized pain that worsens at night, a palpable soft tissue mass, and limp. While osteomyelitis also causes pain, the firm mass and night pain without significantly high fever or open wound points more strongly towards malignancy like osteosarcoma. To two is like action to take: assess neurovascular status. Assess the neurovascular status here. Actually, I put the star if you notice. So these are the correct answers. So the text highlights that tumor growth can cause compartment compromise. The nurse must assess for weak pulse, pallor, paresthesia, or paralysis to ensure perfusion to the limb is maintained. Administer prescribed analgesics. The text notes that the pain from bone cancer is worsened with motions and unrelieved by rest, and requires aggressive management, often including opioids. So the incorrect option: warm compresses increase blood flow, which could promote tumor growth spread. Vigorous exercise is contraindicated due to risk of pathological fracture. So DEXA is for osteoporosis. here. The DEXA is for osteoporosis, it's not for this. Paramedics to monitor respiratory status here and this here. The text states that the metastasis of osteosarcoma is typically to the lungs. Monitoring respiratory effort and breath sounds is critical to detect early signs of pulmonary metastasis. Additionally, if opioids are used for pain, respiratory depression is a side effect. The next one is the serum alkaline phosphatase, the ALP. The text indicates that ALP and lactate dehydrogenase, the LD, levels are frequently elevated on osteosarcomas due to increased enzyme activity and deterioration of the bone. So the incorrect blood glucose and urine-specific gravity are not specific indicators for bone cancers. So here it's like kind of to understand how in this chapter we have about like bone cancer. We go next. Here is my last section of this video. Nursing plan of care adolescent with osteosarcoma. So based on osteosarcoma case study we just discussed, I have this nursing plan of care. This connects the clinical judgment we just exercised earlier. So the intervention for here, for the first one. So assessment, so recognizing the cues, intervention, assess pain, intensity using a numeric scale 0 to 10 and identify triggers, like example, movement, nighttime, monitor, the respiratory rate and level of consciousness, LOC, frequently. So the rationale is pain in osteosarcoma is often severe and requires aggressive opioid management. Monitoring LOC and respiratory is critical to detect opioid-induced respiratory depression. So here is domain safety and infection control. Intervention, perform neurovascular checks on the affected limb every 4 hours, pulse, pallor, paresthesia, paralysis, and pain. Rationale is because tumor growth can cause compartment syndrome or neurovascular compromise. Early detection prevents permanent loss of function or limb. The domain is psychological adaptation. To action to take is for pathological fracture related to bone weakness and destruction secondary to the tumor. So action to take: intervention, administer analgesic, opioids and NSAIDs around the clock rather than PRN was needed for the first 24 to 48 hours to acute flares. So the rationale is continuous pain management, maintain a steady therapeutic level, preventing breakthrough pain that is harder to control. The domain is pharmacological therapies. Intervention: handle the affected extremities gently, support the limb above and below the joint during movement. The rationale here is the bone is weakened by the tumor. Rough handling can cause pathological fractures. So here is the domain based in care and comfort. So the bone is weakened by the tumor. Rough handling can cause pathological fracture. So you need to handle the affected extremity gently. Support the limb above and below the joint during the movement. Intervention: prepare the client for radiation therapy if prescribed by ensuring the skin is clean and free of lotion, deodorants, or creams. The rationale here is those substances can increase the risk of radiation burns or skin irritation. Domain: reduction of risk potential. We have teaching, health promotion, intervention: instruct the client and family on fall precaution at home, remove scatter rugs or use rails. The rationale is minimizing fall risk is crucial to prevent fracture in the compromised bone. So here is safety and infection control for the NCLEX domains. Intervention: encourage high protein, high calorie diet. The rationale is like cancer and its treatment increase metabolic demand. Protein is essential for tissue repair and wound healing. NCLEX domain based in care and comfort. So encourage a high protein, high calorie diet. Evaluation: evaluate outcomes. Goal met if client reports pain is controlled to a tolerate level. Pain is less than 3 out of 10. During activity, client demonstrates no signs of new fractures. Skin remains intact during radiation therapy. And here the part 3 of chapter 53 ends. Thank you for being with me this long video. I hope it's helpful. Let me know if this makes it easier for you to understand.
We finally made it! Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.